So don't worry, this webinar is going to be recorded. So if you have to leave or you're popping in later in today, thanks so much for joining us. We'll be sending this out. So first, we always want to give a huge thanks to our sponsor, which is the UC Davis Western Center for Agricultural Health and Safety, for helping us bring this to you. This will be in Spanish, so para escuchar en español, busca en la barra de herramientas en la parte de abajo de su pantalla y haz clic en el botón del globo que dice Interpretation y elige Español. We're going to start off this morning with Del Garcia. She's the Director of International Projects and Emerging Issues for the Migrant Clinicians Network and has worked for 30 years to meet the healthcare needs of migrant workers and other underserved mobile populations. With an expertise in reproductive health, access to primary care, chronic care management, and infectious disease control and prevention, Del serves as a liaison between the governmental and health NGOs of the US and other countries. After hearing from Del, we're going to move on to hear from Dan Liner, who's the area manager of the San Fernando Valley Cal OSHA Consultation Services Office and has almost 30 years of experience in the health and safety field as an industrial hygienist. He holds a bachelor's and master's in environmental and occupational health from CSU Northridge and was an instructor with CSU Dominguez Health Certificate Program in Environmental Safety and Health and with their OSHA Training Institute Education Center before joining UC San Diego's OSHA Training Institute Education Center. And we'll finish off with Seth Merton. He is an associate attorney at Barsamian and Moody and practices all aspects of labor and employment law, representing employers in state and federal courts and before the NLRB, ALRB, USDOL, DFEH, EEOC, Cal OSHA Appeals Board, and other agencies. He has extensive experience defending agricultural employers in complex wage and hour and representative class actions, as well as wrongful termination, harassment, discrimination, and retaliation claims. So with that, I'm going to stop sharing and invite everyone throughout the entire presentation. Please use that Q&A to send in your questions, as we will be addressing those at the end. And I'll invite Del up to share her presentation.
Thank you so much. So good morning, everyone. I've shared the wrong thing yet again. Please excuse me. I've been asked to come and talk a little bit about the evolving nature of COVID-19 safety recommendations. And so I just want to have the opportunity to give you some of the background on MCN quickly so that you know why we've been asked to speak to you as I move into then a rapid discussion of COVID. Migrant Clinicians Network is a national clinical network of healthcare providers, all of whom serve migrants as one of their principal patient populations. And so we've now been doing this work for about 32 years and have a broad national representation where we really do try and look at a variety of programming issues. We do a great deal of resource development and dissemination. We do some work on advocacy and policy, as the need to have the health perspective in a number of things that are discussed as it engages with agricultural labor is important. But we also feel like what we need to do is advance knowledge and really talk about research, novel research, because so much of what is done on a larger scale really does not look at the issues in terms of the impact of migration on health. And we really believe that that's one of the principal areas of concern. And then one of our biggest efforts is really in doing support to clinicians and capacity building for them, because many clinicians come out of their professional training without having had exposure to agricultural workers and the issues that might be most common when caring for that patient population. So I want you to know that we have a deep background in COVID. Our chief medical officer is a hospitalist. He's now taking care of his 1,000th patient. We've done a great deal with the funded health centers, federally funded health centers, lots of lives training on webinars and Facebook. We really have tried to focus on the guidelines around risk reduction and the resources for different campaigns that others are doing, with a focus on Spanish language and Haitian Creole materials, because those individuals do have a great deal of vulnerability and we don't see them addressed as clearly in many settings, although California is really an exception. They do quite an outstanding job with so much of their work. But we also have a project called Health Network, which provides continuity of care. And so we have a portal where farm worker patients can be registered at the time that they receive their first dose of a 2-dose vaccine, so that we can make sure to contact them and support them in getting the second dose of the appropriate vaccine should they move from the site of the first dose. So it's really through these extensive partnerships where we've really tried to look at not only the needs of the agricultural worker population, but also the healthcare providers who care for them, because this has really been, I think, quite difficult for them as well in terms of treatment and management and trying to respond to this. Additionally, what we keep hearing from groups like the CDC and others is that there is not farm worker specific data. So when we look at what's being collected around vaccine distribution, for example, it is broken down by age, gender, racial, and ethnic groups, but they are not asking specifically the labor group in which the person is engaged. And also they are not trying to do a calculation of the number of vaccines offered versus the number of vaccines taken. And I think it is that rejection rate that's also going to be very important. So that is one of the data that we are collecting. Oops, excuse me. I think that all of you, certainly California and Cal OSHA, will be addressing some of this. But I think what we keep trying to make sure and reiterate is that if we can really pay attention to the public health recommendations, so that when we look at trying to update any accommodations, that they're really science-based, because the epidemiology is evolving. And so, you know, the assessment of risk sort of is ongoing. And I think those updated recommendations are based, and we want you to take into consideration evidence around transmission risks for infected people without symptoms and before the onset of recognized symptoms, because that is the period of greatest risk for everyone around them, certainly those individuals who are not vaccinated. The ongoing community transmission in many parts of the country is doing quite poorly. It's really going on at a rate that by now we would have hoped would be much reduced. Some places are doing a much better job than others. But I think in general, there's a need to communicate effectively with the public, the general public, in addition to those groups that you are most directly engaged with, so that they can have a clear understanding of not only what are the national recommendations and what is understood based on this level of research, but also what is actually going on in your local community. So I think by and large, for most of us engaged in this work, the focus is really continuing to be on reducing transmission through social distancing and other personal prevention strategies, including the use of personal protective equipment, making sure that there's good ventilation, and some of the other elements that are covered in the standards. I think when we try and look at a labor decision, and certainly I'm not the person who's going to be addressing this most directly, but I think the current CDC guidance recommends, the whole that with possible, that unvaccinated individuals who are exposed to someone with suspected or confirmed COVID should be quarantined for 14 days. And that's consistent with the public health guidance for community-related exposure. And so it's that decision there then of what you do with the segment of the unvaccinated workforce who is exposed to someone known or suspected to have COVID-19. Because the timeline for infection is such that, someone is exposed to the virus, it's incubating within their system. This can go from anywhere to 2 to 14 days, although typically at the end of 5 days, you're starting to see some symptomatology. What becomes problematic, however, is that they may not really be saying full-blown symptoms that are recognizable to everybody, that might even make the person themselves who is ill concerned, doesn't occur until, sort of 2 days into when they have already become infectious to others. And so it is that 2-day period that I think becomes so important for people to consider. is that yes, very early on, the exposure to the individual is such that they're just incubating. When they themselves then become infectious, they may not be fully aware that that's what's happening to them, and it may not be visible to those around them. And so then their ability to infect other people is really great in those couple of days between the fact that they are infectious and they start to demonstrate symptoms. And so, this is where the cycle comes in then. We have someone who was infected, they're incubating this. People are not aware that they are contagious at that point. They in turn have an exposure to someone else who's not been vaccinated, and even those individuals who are vaccinated can continue to be infected. It's just that the results will be much more mild. But this is how the cycle continues. And so when we're talking about that labor decision, is what to do with this person during those 14 days when they've been exposed to someone who was known or suspected to have COVID-19, so that we don't just continue that cycle. And that's one of the decisions that you all need to make about how you will manage your labor force. Because what we really know about COVID is that the reproductive number, in other words, the number of individuals who, if exposed to that agent, will then become infectious themselves, infected and infectious themselves, is really an important consideration. I think before the social isolation went into effect and all of the social distancing and the actions we're taking, the reproductive number was 4.02. But after the isolation measures were put in place, that reproductive number dropped to 1.51, which means that without any of these protections, one case is likely to infect 4 other individuals in just the straight numbers. And what we see is that if we're willing to employ the personal protective equipment, the social distancing, that what we can do is cut that in half or better. And I think that is the goal, is really reducing the occasion for someone else to be infected by someone who is infectious, but perhaps it is not known to them. And so, here's your consideration, is, allowing exposed and asymptomatic people, of critical infrastructure workers is the phrase that's used, to continue to work, when it's necessary to preserve the function of the workplace. I think we saw this in agriculture, particularly around time-sensitive work that needs to be done, because crops are in the field, they need to be pulled. It is now at the point where the losses will be enormous if we don't move on. So, I think that the decision to bring someone who has been exposed back into the workforce prior to the 14 days, I think is an option of last resort. And really only in limited circumstances, and you look very carefully at the kinds of protections that you can put in place if there is a way to broaden the distance between them and anyone else with whom they might work, where they might be given housing and transportation that would protect others but allow them to continue. All of these are very difficult decisions, and certainly something that you're going to need to consider. But I think we really want to encourage you that in this experience, you work with the public health officials, because I think to manage the continuation of work in a way that best protects the health of everybody in your workforce and the general public is an important consideration. But we do know that these critical workers can be permitted to continue working if you really, following the exposure to a person with suspected or confirmed COVID, sort of providing that they remain asymptomatic and do not have a positive test. So the other piece to contemplate is, in addition to personal protective equipment, in terms of the social isolation, the distancing, that we also then make sure that there is a good system for testing and repeated testing at intervals, so that those individuals, 3 and 5 days afterwards, and then 7 and 10 days afterwards, have the opportunity to be evaluated to make sure that they are not continuing to manifest the COVID-19. So, risk mitigation in many cases is what we can work towards and what we hope is the consideration of individuals who are engaging with a large labor group. And so we do want to encourage employers to have a mechanism of pre-screening where there will be screening prior to entering the workplace, perhaps from home before they come on site. Excuse me, that there is a conducting of symptom assessment on site, including temperature screening. It does not mean that every person who has COVID-19 will manifest a temperature, but these are just efforts that you make to try and be vigilant in reviewing your workforce to see what's going on. I think regular monitoring, if employees don't have a fever or symptoms and they can self-monitor, under the supervision of their employer's occupational health program or their workplace COVID-19 coordinator or team, or whatever is the mechanism employed within these settings. I think that the regular monitoring piece is one of the ways that we really will be able to reduce spread. And I think cloth masks. I would really love to see a lot of employees wearing N95s if it was at all possible, but those are expensive, frequently not available, may be costly for the workers. Whereas if you have a good, clean cloth mask that is not just worn perpetually, but that really is changed, that this has a great deal of benefit, because certainly the benefit of the mask is for what gets breathed out by the individual, while it may filter the larger particles of what is being breathed in. That's really not the benefit of the mask overall. It is to keep whomever is expelling virus from being able to expel large amounts. And then, of course, the social distance. If you can maintain the 6 feet, I know that they've tried to say for schools it will come down to 3 feet, but I think you have people who are expending a lot of energy with difficult labor, with labored breathing, with the need to speak loudly, perhaps above machinery. All of these are actions that do expel a good bit of virus. And then I think the cleaning and disinfecting of workspaces will be important in that, areas of communal eating or bathrooms, shared equipment are all important places where, while it is not as important, surfaces are not as important as certainly the breathing and the exchange through personal space, there is a lot of value in making sure that cleaning and disinfecting of workspaces is ongoing. So I think, when you have the work sites and you have shared housing and you have shared transportation, those are unique challenges for preventing and controlling spread of COVID-19. And so I think you do want to make sure that there's consistent application of that specific preparation and prevention and management measures, so that what we're looking at then is over time, that cycle of interruption, so that we don't have the kind of transmission that makes disease so common. And this is a large scale graph that has a lot of information, only to say that you need to be mindful of the type of testing that you're trying to engage in. I think if somebody will tell you that you need to look for antibody detection, that is really post the period of infection. And that's the period post-infectiousness. That if really you want to look for the fact that someone may be currently infected and then soon to be infectious, that you want to look for the nasal evaluation where they take the swab from higher up in the nares. While uncomfortable, it is going to tell you what is the current state of someone that can put other individuals at risk. And I think that that is the important issue that we're trying to go after, not whether or not someone has already been exposed, because we know that someone can be exposed and infected again. And the antibody testing just give you the state of the body post-infection by looking at the reaction of the immune system in response to that exposure. But what we want to look at is that period between, one week before the symptoms have come on, and 1 week after the first presence of symptoms, because that's when you're likeliest to see through the nasal swab and the virus isolation in the respiratory tract, whether or not you have somebody who is currently infectious with COVID-19. So I think from the public health guidance perspective, it's reintegrating exposed workers who are not experiencing any symptoms and have not tested positive back into the on-site operations is considered from a public health perspective to be the thing of last resort, and only in limited circumstances, such as what I was saying, that the cessation of those operations would cause serious harm or damage. And so, public health, public safety being the critical piece. And I think that employers are encouraged to work with their public health officials to determine the safest way to integrate exposed workers who are not experience any symptoms and have not been vaccinated and have not tested positive back into your on-site operation. Until a majority of the labor force is fully vaccinated, it is going to be that issue of how we monitor should people have been exposed, and then trying to manage appropriately the integration of exposed workers into the labor group that is ongoing on a day-to-day basis. And so I hope that made sense. And if we have any questions, I'm not quite sure how questions will be managed, but we can come back later on if something that I said doesn't make any sense. Thank you so very much.
Thanks so much, Del. Yeah, we're using the Q&A, which most of our questions we're going to hold to the end. But while Dan brings up his presentation, we'll take Caroline's question. She asks if we should continue regular testing then. Do we need to test anyone who has already been fully vaccinated?
Individuals who've been fully vaccinated can still be infected. What we don't know is if someone who's been vaccinated, if exposed, will then infect others. That continues to be the question that is being researched. I think that what's going to be important is the testing of individuals who've not been vaccinated, because even if the vaccinated individual is exposed and does become ill with COVID-19, what is truly the case is that with vaccination, they won't present with that exaggerated illness, that severe illness that generally runs the person into then needing hospitalization, and unfortunately, in many cases, ventilation, which is the intervention to be avoided if at all possible, because so many of the individuals who enter the hospital, if they transition to needing ventilation, huge percentages of those individuals are not surviving because of a number of comorbidities and other elements. But what we want to avoid is severe illness.
Okay, thanks, Del. So if anybody has other questions for Del, please pop those in the Q&A and we'll address them at the end. Same for Dan here. Please use that Q&A function at the bottom and take it away, Dan.
All right, thank you. Well, I'm Dan Liner. I'm an area manager with Cal OSHA Consultation Services based out of the San Fernando Valley. And what I'm going to go over today is just briefly review the Cal OSHA's COVID-19 regulations. I'm going to talk a little bit about what Cal OSHA enforcement has been doing during the pandemic, and then at the very end, provide you with a few resources. Cal OSHA adopted an emergency temporary standard at the end of November, in November of 2020. And after it was approved by our standards board, it went to the Office of Administrative Law for final approval. And the Office of Administrative Law approved the regulation on November 30th of 2020. Because it was an emergency temporary standard, it went into effect immediately. So on November 30th, these new regulations went into effect. Prior to the adoption of these regulations, Cal OSHA used the Injury and Illness Prevention Program to address COVID-19 in the workplace. On inspections conducted after November 30th of 2020, Cal OSHA inspectors are using the new emergency standard. Being an emergency temporary standard, it has an expiration date. This regulation is set to expire on October 2nd of this year, unless there's some amendments to the regulation, including they can ask for a couple extensions to continue with this emergency temporary standard. But in the meantime, they're working on a more permanent regulation. So this is kind of a wait and see what happens with the emergency temporary standard. What was adopted were 5 new sections to Title VIII. And Title VIII are the regulations that Cal OSHA enforces. The main section is section 3205, which deals with COVID-19 prevention and requires employers to develop a COVID-19 prevention program, which is a written program. Then there were 4 additional sections adopted. The first two, 3205.1 and .2, address outbreaks in the workplace. Point 1 deals with minor outbreaks, and 3205.2 deals with a major outbreak in the workplace. And then point 3 and point 4 were adopted, which are really for the agricultural industry, because they address employer provided housing and employer provided transportation to and from work. So these are for workers that are in the United States under the H-2A and H-2B visa program, where employers are required to provide the housing and the transportation. Now, the new COVID-19 prevention regulations apply to all employers and all places of employment in California. There were 3 exceptions to the regulation, but none of those exceptions apply to your industry. So the COVID-19 regulations do apply to the ag industry. Now, the program, the COVID-19 prevention program that's required under Section 3205, the regulation states employers shall establish, implement, and maintain an effective written COVID-19 prevention program. And shall means it's mandatory. You need to have this program. And then the words I've underlined are the important terms. You need to develop this program, establish it. Whatever you put in your written program, you should be doing in the workplace. That's the implement part. And then maintaining the program, make sure it stays up to date. So because COVID-19 is changing so much and things are changing, you want to pull this regulation, review this, your program periodically, and make sure that it does not need to be updated. And then it should be effective. If you're still having if you're having outbreaks or you're having issues in the workplace, it's telling us the program is not effective. So you want to reevaluate your program to figure out what you can do to make it more effective. Now, this program can be part of your injury and illness prevention program, or it can be maintained as a separate standalone document. And I really recommend that all safety and health programs be maintained as separate standalone documents. The written program has 11 elements to it. And many of these elements, you'll notice if you have an injury and illness prevention program, are very similar to the requirements of the injury and illness prevention program. The first being communication. You need to make sure you have good communication between workers and management, and good two-way communication, that you've done an evaluation of your work processes and your work environment to identify places where COVID-19 can be a hazard. That if you have cases, that you investigate how that person might have been exposed and who they may have exposed in the workplace. That if you've identified hazards or a place where there could be an exposure in the workplace, how you're going to correct that hazard. that you train your employees on the hazards of COVID-19 and how to protect themselves, and that you have this program and that you require certain things such as the face coverings and the physical distancing. So the next two sections are the physical distancing and face covering requirements. The eighth element deals with if you find unsafe conditions in the workplace that you're going to implement controls to make the workplace safer. Then there's a section on reporting, record keeping, and access to the program. Reporting would be to the local health department. Record keeping would be maintaining documentations and whether these cases go on your OSHA log 300 or not. The 10th element is exclusion of COVID-19 cases. So this is having people stay home and not be allowed to come into the workplace and expose other workers. And the 11th element is when those excluded cases can be allowed to return to work. And the regulation as it was written uses the 14-day guidelines, the 14 days of isolation or quarantine that Dell referred to. However, the CDC came out with some guidelines that said workers can return after 10 days if needed. Ideally, it should be 14. But if it's too much of a hardship, they're allowed to return to work after 10 days. And while the regulation says 14 days, there was a governor executive order that allows employees to return to work after 10 days if 14 days is not feasible. We've been getting a lot of questions about COVID-19 vaccines and once a person's vaccinated, do we still have to follow the COVID-19 regulations? The vaccines are not addressed anywhere within the regulations. So if you look through the regulation, you will not find the word vaccine, vaccinated, anywhere within the regulation. We have a COVID-19 frequently asked questions page, and there is one question right now regarding vaccines. And the question on that page is, once an employee is vaccinated, must the emergency temporary standards still be followed for vaccinated persons? And the answer, the official answer from Cal OSHA right now is, for now, all preventative measures must continue to be implemented. The impact of vaccines will likely be addressed in a future revision to the emergency temporary standard. So even if you have workers that are vaccinated, the entire regulation still needs to be implemented in the workplace, including the physical distancing, the face coverings, everything is still in play and is enforceable by Cal OSHA enforcement. So let's get into the four other sections. The first section, the other section 3205.1 that deals with outbreaks, deals with minor outbreaks. And a minor outbreak is when you have 3 or more COVID-19 cases in the workplace within a 14-day period. And this will continue to be required to be implemented in your workplace until you've gone at least 14 days without a new case. And what this section does is it requires certain things like testing of workers once a week for people that were exposed to those individuals, that you reevaluate the workplace, that you implement controls. And this is the point where you would also notify the local health department that you're having a minor outbreak. The next section, 3205.2, deals with major outbreaks. And a major outbreak is defined as 20 or more COVID-19 cases within a 30-day period. It has very similar requirements of the minor outbreak section. The main difference is, instead of testing the exposed workers, potentially exposed workers once a week, you'll be testing them twice a week. And then it has more stringent controls and things you need to do to address the outbreak in the workplace. The next section deals with employer-provided housing. And it applies to all types of employer-provided housing, be it from trailers and campers and tents to labor camps. It includes apartments, hotel rooms, any place that employers are providing the housing. And the issue with housing is employees are not on paid time at housing. So as an employer, you have less control over what your workers can do. So you can't just necessarily write up a worker at their housing because they're not on company time. But what the concept is for employer provided housing is to take the concepts that we've applied to the workplace and apply those in the housing and stress the importance of continuing the physical distancing while at home, wearing face coverings when they're outside of their group, their housing unit, things like that. And then if people are having symptoms, that you have a place where those people can live without exposing other workers, again, to reduce the spread. So that's really this part about the employer provided housing, is to make sure that what you've taken at work about the sanitation and the distancing and face coverings, and try and apply that to the housing units to stop spread at home. And the last part of the regulation is 3205.4, which addresses employer provided transportation to and from work. And again, this applies to all types of transportation, whether it's a van, if it's an old school bus that you're using to transport workers from the housing to the job site. It applies to carpooling. So if you have workers that are carpooling, this is very important, again, and it addresses the sanitation in the vehicle to make sure that surfaces are cleaned regularly. It requires good ventilation, which means the windows are open while people are in the vehicle, that they wear their face coverings, that they maintain physical distancing. Well, our regulation addresses a physical distancing of 6 feet at places of employment. Inside transportation, it was reduced to 3 feet. So their workers are allowed to be 3 feet apart from each other in transportation. So that's the important thing. So if you have workers that are carpooling, that is still required to maintain, as much distancing as possible, to wear the face coverings, to use hand sanitizers as they get in the vehicle and out of the vehicle and such. Just real fast, I want to talk about what Cal OSHA enforcement has been doing. Before the pandemic, Cal OSHA typically handled the enforcement part of Cal OSHA. I'm with the consultation part. So the enforcement part of Cal OSHA handled between 10 and 13,000 complaints a year. And they did actually about 2,000 to 2,500 actual on-site inspections. The remainder of the complaints were often addressed by letters, where somebody was alleging a minor condition or a serious condition, but they didn't give their name. So it was not considered a formal complaint. In 2020, Cal OSHA received 10,000 COVID-19 complaints, just COVID-19 complaints. So in a regular year, when we received 10 to 13,000 complaints, they received that number of complaints that were specific to COVID-19, plus there were additional complaints. They were still able to conduct about 1,900 on-site inspections of facilities. They issued over 8,000 of those letters that we're going to talk about. They did not issue a lot of COVID-19 citations during calendar year 2020. They issued about 296 COVID citations. And the reason for that is from the first date on site, Cal OSHA has 6 months to issue the citations. So we're seeing the citations being issued. The 296 citations were really from inspections that happened in March, April, May, and June of last year, which is the start of the pandemic. So this year in 2021, we're going to see a lot more COVID-19 related citations than we saw last year. Now the letters, those inspections by letters, they have two letters, a letter D and a letter M, and they're basically for non-formal complaints. And the non-formal complaint is when somebody cannot or will not give their name, an employee representative can't or will not give their name, or if a non-employee calls in a complaint about a company. So letter D is for something, a complaint alleging a non-serious hazard in the workplace. And OSHA will send out a letter to the employer with the alleged condition and ask the employer to respond in a certain time period. And if they're happy with your response, the case gets closed. And in about 1 in 20 of these letters, they will actually send an inspector out to verify that the condition doesn't exist or that it was corrected. The letter M's are, again, very similar. It's a non-formal complaint, but this time it's alleging a serious hazard. And when it's a serious hazard, Cal OSHA will start the investigation by telephone. They will call the company, talk to a member of management, let them know about the complaint, and then follow up by fax or by email. And then the employer needs to respond back. And again, if they're happy with the result, with the response, they'll close out the case, and they're supposed to conduct a follow-up inspection on about 10% of these. So 1 in 10 will actually have an actual inspection. One thing I just wanted to remind people of, just quickly, I went over the COVID-19 information rather quickly, and we have we've been doing half-day webinars going over the regulations in greater detail. I also want to remind people that we're approaching the heat season. So I want people to remember, just because there's the pandemic, don't forget that we have our heat illness regulation. And in agriculture, the heat illness prevention regulation tends to be the #1 most cited regulation within your industry. So don't forget to address heat illness as it gets hotter. And there's going to be some challenges because of the pandemic, especially for physical distancing. And this is going to be especially an issue during break and meal periods because of the amount of shade. The heat illness regulation requires that you provide a shade for your workers, but now because of physical distancing requirements under Section 3205, the COVID regulations, you can't get all the same number of people in the shade. So you're going to need either additional shade structures, or you're going to have to really focus on staggering break and meal periods to allow your workers to take their breaks and meal periods in a shaded area. You're going to have to address things like water. If you use a water dispenser where people are touching a nozzle, part of COVID-19 is sanitizing, cleaning and disinfecting those frequently touched surfaces. So if you're using a water dispenser, to make sure that the dispenser nozzle is cleaned really frequently, and that people are maybe using a hand sanitizer before touching the nozzle on the water dispenser. And the other important thing is going to be acclimatization, and that's getting used to the higher temperatures. And that occurs usually over a couple-week period. And as temperatures start to gradually increase, we will naturally acclimatize. But if, today in Los Angeles, it's kind of overcast and damp outside. But if all of a sudden we have a heat wave, people have not had time to acclimatize. And you're going to have to take into account this year that it might take a little bit longer to acclimatize because we have people wearing face coverings, which makes it a little more difficult to breathe, because we're wearing these coverings. So be sure to take that into account during acclimatization this year. The other thing I don't have a slide on, but just make sure that don't forget, as we approach summer, we also approach wildfire season. And when wildfires start to break out, And if you're downwind in a smoke area, you're going to need to make sure you have those N95 respirators. Those are a requirement of our wildfire smoke regulation. And quite often when there's wildfires, the State Office of Emergency Management will release stockpiles of respiratory protection to your industry. So just keep your ears out for that, and hold on to those N95s. And they can be reused a few times. So don't just throw them out. Make sure they get assigned to workers and have them reuse it. Cal OSHA, I just want to talk on a couple of the resources that we have. We have our coronavirus page. So this is the link directly to our coronavirus page. And the very top, on the image on the right is what you'll see. The top box has the emergency regulations, the frequently asked questions you'll find on that page. And you'll also find, if you have not developed your sample written program, you'll find a sample program in English and Spanish in Word format. So you can just open the document, save it to your computer, and tailor it to your company. The second box has guidance by industry. So there is guidance specifically for your industry on that page. There's a box that has frequently asked questions, and on that page, there's some additional material. The next box down, which is educational materials and the resources, actually has some videos that have been designed specifically for agriculture. The fifth box is the link to our webinars on COVID-19. Right now, we don't have any scheduled, but we are going to be scheduling some additional webinars. We're going to start up our industry-specific webinars, which will include agriculture, and we're going to actually record our main COVID-19 webinar that you'll be able to go on to our website and listen to any portion of our webinars. And then we have what's called the Cal OSHA Training Academy that has a couple of videos, again, one for workers and one for employers on COVID-19 that you can use to supplement your COVID-19 training. And this is Cal OSHA's main website. And on this page, you'll find all of our regulations, links to the regulations, to our various publications, reporting and recording information, our various policies and procedures. And the COVID-19 information is on the very top right of our screen in that emergency response box. You'll see up there, it says Cal OSHA Safety Guidance on Coronavirus, and that's where you'll find the link to our coronavirus information. If you have questions on safety and health, we have 7 consultation offices throughout the state. I'm out of the San Fernando Valley office, but we have offices statewide. And if you have operations outside the state of California, every US state and territory has a free consultation service that's familiar with that state's OSHA regulations. So if you have questions on any safety and health topic, feel free to call one of our offices and ask to speak with one of our consultants. And with that, I'm going to stop sharing, and thank you for your time, and we'll turn it over to Seth.
Thanks so much, Dan. Yeah, we're going to bring Seth up if you want to share your screen. And we've got some more questions coming in, so just keep putting those in the Q&A and we'll address those once we're at the end here. Take it away, Seth.
All right, good morning, everyone. It's a pleasure to be with you. My name is Seth Merton. I'm an attorney at Barsamian and Moody. We are an employer-side labor and employment law firm. We're located in the Central Valley, specifically in Fresno, and we defend agricultural employers in a number of different types of legal actions, such as wage and hour, class actions, labor commissioner hearings, Cal OSHA citations and enforcement actions, wrongful termination, discrimination lawsuits, that sort of a thing. In essence, anything that would be brought by your employee against their employer, we would be jumping in to defend the employer. And then we certainly help with kind of guiding employers to make sure they're compliant with all of the different California labor laws that are out there. I know there are so many. So today I'm going to be talking about SB 95. This is California's new supplemental paid sick leave law. I'm also going to then briefly touch on some COVID-19 vaccination issues. I know there's so many questions about vaccination, so I'm just going to kind of briefly touch on some of the issues that we're hearing come up most frequently. Before I begin, I just want to cover a kind of a quick obligatory legal disclaimer for this presentation. The information that I'm going to talk about, I'm going to discuss in a very generalized matter. The information should not be considered legal advice or legal counsel. So if you have specific questions, I'm happy to connect with you or chat after the presentation. But in terms of what I'm going to talk about in this presentation, it's not going to be kind of individually tailored to your specific situation. So please don't take it as legal advice for what you should be doing given your particular situation. With that said, we'll get into 2021 COVID-19 supplemental paid sick leave, which is SB 95. So SB 95 is a new law. It was signed into law on March 19, 2021. The important thing to note here is that this law is different than the prior COVID-19 supplemental paid sick leave laws that were out there. So many of you have already paid maybe the federal Families First Coronavirus Response Act leave, which was the 80-hour, up to 80 hours that was available last year through the federal government, their program. There was also, as we know, for larger employers, there was the state's kind of food sector supplemental paid sick leave, which just kind of mirrored the federal law. So this is not that. This is something that's new. It's very similar to the prior programs that were out there, but the important thing to walk away with is knowing that if you previously paid someone out for 80 hours of paid sick leave, this is a new batch of 80 hours that we have to be thinking about. So we'll just kind of briefly touch on some of the specifics: who are covered employers, who are the eligible employees, how much leave do they get, and then when they do take leave, how much are we paying them for that leave. So in terms of covered employers, SB 95 applies to employers with more than 25 employees. As I've surfed the internet and been looking at other folks' guidance on this, occasionally I will see websites that will say that it applies to employers with 25 or more. That's incorrect. It's actually more than 25. So we're thinking about employers that have actually 26 or more employees. So that's the employers that need to worry about it. It applies to both private and public sector employees. And then the big question that we've been getting is, how do you go about counting the number of employees that you have working for you? So this law contemplates the need to count full-time, part-time, temporary, seasonal employees. It's really anybody who's working for you. And then it also extends to the joint employer situation. And the big question I'm sure many of you are wondering is, hey, I'm an FLC. Do I need to count the other FLC employees that are working at a particular grower's ranch? Or if your growers may be wondering, your clients may be wondering, hey, the employees that you're providing me, do we need to be counting those employees? And the answer is probably yes. The law doesn't specifically cover it, but the labor commissioner historically has taken kind of an expansive view of what is considered to be an employee. And so it is most likely the case that you will need to count the FLC employees that are working at a grower. So, anytime that the employees aggregate to be more than 25 employees, then you're going to need to figure out a way to get, someone's going to need to pay the employees for this sort of leave. And in terms of kind of when you make that calculation, we're talking about the kind of the window where the employee is going to be taking the leave or beginning their leave. So you may have had 25 employees in January, but you've only got 5 now. You wouldn't be covered. Simultaneously, you may have 5 employees now, but as you begin to ramp up for harvest, I could see a scenario where you suddenly jump up over 25, and now you're going to be covered. In terms of who is an eligible employee for SB 95 leave, the law is going to pretty much cover every employee that you have. Independent contractors are not eligible for this leave. So if you've got a bona fide independent contractor working for you, that individual or that entity is not going to be covered. But the big thing to watch out for with independent contractors is making sure that those independent contractors are actually independent contractors under California law. As we all know, California law has a very expansive interpretation of who constitutes an employee. And so you want to make sure that if you are considering someone an independent contractor, that they are actually legally a independent contractor and that they are not misclassified as that. And just another note with regard to who's eligible, anybody who's maybe got some sort of paid sick leave that's coming from another body of law, be it just your regular California state mandated paid sick leave, maybe Arizona employee with paid sick leave, or maybe that you work in a locality where there's a municipal ordinance that has some allotment of paid sick leave. This law is going to apply in addition to that as well. So that employee won't be ineligible per se just because they are receiving California paid sick leave or Arizona paid sick leave or any of the other paid sick leave ordinances or laws that are out there. So the big thing to note with an eligible employee is they're going to be eligible as long as they are taking SB 95 for a covered or a qualifying reason. So this slide covers those qualifying reasons. What you'll notice is that they're very similar to the prior supplemental paid sick leave laws that were out there. So if an employee needs to take time away from work for kind of care for themselves, either because they are subject to a quarantine or an isolation order, or they've been advised by their doctor to quarantine, or because they are experiencing symptoms and seeking a medical diagnosis. If they fall into any of those situations, then they would qualify for SB 95 leave. In addition, if they are caring for a family member who falls into any of those scenarios, subject to a quarantine order or advised by a healthcare professional, they'd also be eligible to take SB 95 leave. And then if they have a child at home who is, their school or their place of care is now shut down or unavailable due to a COVID-19 related reason on the premises, then that too would enable the employee to take SB 95 leave. And then the new one that is out there that was not, wasn't in the prior federal and state supplemental paid sick leaves is this last reason. It's the vaccine related reasons. So if an employee is either attending a vaccine appointment, or if they cannot work or telework because they're experiencing some sort of vaccine related symptoms, they're just kind of, they're not feeling great, then that too would be a reason that would entitle them to take COVID-19 supplemental paid sick leave under this law. So those are your covered reasons though. And then in terms of how much leave does the employee get, they're going to be entitled to up to 80 hours. And so what you're kind of always keeping in the back of your mind is the idea that the intention of SB 95 is to provide employees with 2 weeks of paid sick leave. So up to 2 weeks, right? So it's going to be, we're going to generally be entitling them to whatever amount of time they would have otherwise worked in a 2 week period. That's generally what they're going to be entitled to take for COVID paid sick leave. So if they're a full-time employee, meaning they work for at least 40 hours or more per week, then they're going to be entitled to a full 80 hours. And so, the top of the slide, we've got this, kind of the two scenarios where you would need to provide 80 hours, which is either you consider them a full-time employee, or like I said before, they work an average of more than 40 hours or at least 40 hours per week. If they don't fall into that criteria, so if they're a part-time employee, then there's a few different calculations that you would make to determine what amount of paid sick leave they would be entitled to. And again, the intent is just to replace what they would have otherwise worked during a 2-week time frame. So if they've got a normal weekly schedule, then you would just be looking at whatever that normal weekly schedule is over a 2-week period, and that would be the amount of leave that they were entitled to. If they don't have a normal weekly schedule, if they've got a variable schedule, maybe they're working 20 hours one week and they come back the next week and work 10, and then some weeks they work 30. If the number of work weeks or if the number of work days vary, then you'll need to use one of these other formulas. And so here in prong B, you can see that if they work variable number of hours, then you're multiplying whatever the average number that they've worked over the prior 6 months. You'll just multiply that number by 14. So if they tend to average 5 hours a day, then you're just going to multiply 5 by 14 to come up with the number of hours that they would be entitled to. And then if they haven't worked the requisite amount of time, right, they haven't worked 6 months, then you would just be using the full length of their employment to determine kind of what the average number of hours they work each day is. And then if they haven't worked 6 months, maybe they're a brand new employee, they've only worked a couple days for you, so you really can't determine how much they're going to be working, then you would just be looking at the total number of hours that they have worked for you. So that is how we go about calculating how much leave someone is entitled to. And the last thing to really be aware of is that we've got to then figure out how much we have to pay them for that sick leave. So, at what hourly rate are these hours paid out at? And the answer is that the SB 95 says we pay it at the highest of, and they give several different formulas. So generally, the first one's going to be, you're just going to take whatever the regular rate of pay for that work week in which they're taking the leave is. So if they're making $15 an hour, then you're going to be multiplying 15 times however many number of hours they're using for their paid sick leave. However, if state minimum wage for some reason is higher, then they would get that. If local minimum wage happens to be higher, then they would be entitled to that rate. And then this last one is, you calculate the rate by dividing the employee's total wages, not including any overtime premiums, but their total wages for the hours worked in full pay periods during the prior 90 days of employment. And you would just calculate the regular rate that way to see if that ends up being a higher rate. And then you would just pay out that rate for every hour of COVID paid sick leave. If you have an exempt employee who happens to be taking COVID paid sick leave, you would just be paying them in the same manner that you would pay other paid sick leaves. So that would usually be your regular California paid sick leave. And then, I don't imagine many of your employees will fall into this boat, but if they did, just know that currently the law caps the amount of paid sick leave under this law at $511 per day, or $5,110 for the total 80 hours. So to the extent that you've got a very highly paid worker, then the rate might be capped. And then just another quick note in terms of calculating the regular rate of pay, as you always do, you'll be including within that calculation any commissions, any bonuses, any piece rate earnings, it's any fixed compensation that an employee would be entitled to. You're going to include that in the regular rate of pay and making that calculation. In terms of the notice that you need to provide to employees, the DLSE, or the state labor commissioner, has already developed a English and a Spanish poster. These links that I've provided here, you can access those posters at these links. And then the other form of notice that you have is just very similar to the type of noticing that you do for regular paid sick leave. You need to, each pay period, be providing employees with an accounting of how much supplemental COVID paid sick leave they have available or have used. And so I recommend, I think it should just be on your pay stubs in much the same way that the regular paid sick leave should be on your pay stubs. But if you're not doing the pay stubs, if you're providing a separate accounting, then just remember that you've got to provide that during the same time that you make pay stubs available. You need to provide that piece of paper. And then I would just label it something that makes it clear that it's supplemental paid sick leave. So you should have a line item for regular paid sick leave, and then you should also have a line item for supplemental paid sick leave. And then if you happen to have an employee who works a variable schedule, then so you're kind of unable to know when or how much they'll be entitled to, then you can just indicate, do an initial calculation, but then indicate on their pay stub that they are they're variable in terms of the number of hours that they work per week. And so you would do a calculation at the time that they go to use their supplemental paid sick leave. In terms of handling requests, this is an area where you've really got to train your supervisors, your forepersons, crew bosses, anybody who's going to be intaking those requests or could be construed as being in the management of the company. You've really got to train them to be on the lookout for this stuff, because these requests for COVID supplemental paid sick leave can be made orally or in writing. And my gut is that the majority of your requests are going to come orally. It's not going to be the case, I would imagine, that employees are writing down or emailing you their requests. They're just going to say, many of them will probably call you and say, hey, I don't feel great today. Or, at the end of the day, I could see an employee telling their crew boss, hey, I'm not going to be able to come in tomorrow morning because I've got a vaccine appointment, or whatever the case may be. So just kind of keep that in mind, that the requests can be oral and or in writing. And so, again, train your supervisors to be aware of that and to kind of pass that knowledge up the ladder to the appropriate individual who needs that information. And then in terms of selecting how much COVID paid sick leave to use, we've got to let the employee dictate that and decide that issue. So we can't, for example, say, hey, you were out for 8 hours, so we're going to force you to spend down 8 hours of your COVID paid sick leave. The employee gets to decide how much supplemental paid sick leave they want to access. And we cannot deny it. A big question that we've gotten is, can we condition the right to COVID paid sick leave on the employee coming up with some sort of doctor's note or other medical certification? And the answer is no. You cannot condition the right to leave on the employee producing medical certification. You may be able to withhold pay if you have reason to believe the employee is abusing the leave, but that's an area you really want to be careful, because it really is going to get into how reasonable is the information that you're relying on. And many times I would imagine we're going to be relying on kind of the rumor mill or even our suspicion that an employee is abusing it, and not, hey, I personally saw this employee out at the park when they said they had a vaccine appointment or something to that effect. My gut is that more times than not, we're probably going to be just sort of suspecting abuse rather than actually having reasonable information to deduce that there's been some sort of abuse going on. So don't deny it. If an employee requests their leave, go ahead and give them, if it's a qualifying reason, allow the leave to happen. And then, you can determine whether you need to pay it. You've got a little bit of time to make that determination. It wouldn't be due until the payday for the following pay period. So you have a little bit of time to decide whether to pay it. But generally speaking, you're probably going to be better off paying it unless you've got some really sound information that that the leave was not taken for a legitimate or a valid purpose. The last thing to note on just sort of handling these requests, and we're sort of out of this window of having to worry about this, but some of you may have gotten retroactive requests. When the law went into effect in March, late March, it was expressly made retroactive to cover leave that would have been otherwise covered under this law, but because the law hadn't been passed yet. So if there was leave that happened from January 1 of 2021 until March 28, then conceivably an employee could go back and request that they be paid for that amount of time that they were on a qualified leave. So if you got those requests, strongly consider you kind of going back and taking a look at them. But if you didn't, if you're now getting them past March 28, then you no longer need to worry about the retroactive payments. Although, just to avoid a labor commissioner complaint or a labor commissioner inquiry, it may be in your best interest to consider paying it, kind of depending on the circumstances. So I would take those individually and work with your labor counsel to figure out whether you're going to consider retroactive payment requests now, or whether you're going to have a blanket policy of denying them. But I would work with your labor counsel on coming up with that issue. Just a few more issues on just very specific questions we've gotten with regard to SB 95. There is a suspected interplay between the tax credits that were available under the federal Families First Coronavirus Response Act. I'm not a tax professional, so if you're interested though in maybe recouping or taking advantage of a tax credit that for leave that you paid out between January 1 and now, talk with your tax advisor and see if there is a way to access those tax credits. In terms of how it interplays with Cal OSHA's exclusion pay, if an employee is excluded under Cal OSHA's emergency temporary standards, then this law says that you can require the employee to access their supplemental paid sick leave before they are provided with their exclusion pay. And so that's kind of one situation where you could require them to use their supplemental paid sick leave prior to accessing the broadly available exclusion pay. And then just a quick note with record keeping, the labor code requires these sorts of records to be kept for 3 years, and then the labor commissioner and employees can request the records and they would need to be provided to those entities. So make sure you're keeping good records of the payments and requests that you're getting under this law. With that, we'll move to vaccines. I've just got a couple slides on vaccines. It's a wildly fascinating issue. I'm sure that there's going to be an enormous amount of litigation that ensues over the vaccines and employer mandated policies and just really all of the things that surround and encompass the vaccination issues. But in terms of the legal guidance that's out there right now, there's not a whole lot. So there's not a lot to cover here, though I'm sure you'll have many questions. So as we all know, there are vaccines that are now currently available. And while last year we had the benefit of saying, hey, we don't have to worry about whether to require or not require or encourage or discourage employees getting the vaccine, the employers are now confronted with that question of having to decide what to do. So we've obviously got some employees who are extremely excited about it. They want to get it. We've got employees who are very nervous about it. We have employers that feel the same way. They're either really excited about it. They see it as a kind of a silver bullet to this problem, or they're a little more hesitant. So it kind of runs the gamut in terms of employees and employers' feelings about the vaccine. So the big question that we've gotten, kind of the primary question is, as an employer in California, can you require or mandate that employees receive the vaccination? The U.S. Equal Employment Opportunity Commission and the California Department of Fair Employment and Housing have both said that employers can legally require it. As long as they're requiring an FDA-approved COVID-19 vaccination and it's being required in the interest of workplace safety, you can require it. Now, two things you need to be aware of is that you have to make reasonable accommodations for any employee who objects on the grounds of a sincerely held religious belief or practice, or some sort of a disability reason that would preclude them from getting the vaccination. Those are two really big exceptions. So, it's kind of a, yes, you can require it, but there are potentially a lot of employees who would be able to object from getting the vaccination through a employer mandated policy. And then, of course, if an employee did object based on a religious belief or a disability, you would not be able to discriminate or retaliate against that employee. The only way that you would be able to exclude the employee would be whether if you could prove that the providing a reasonable accommodation to the employee would impose an undue hardship on the employer. That being said, that's an extremely high burden to prove. So this is not just the, hey, this is going to be kind of annoying or expensive for us to comply with if the employee doesn't get the vaccine. It really is a very high bar to meet. So it's not the conclusion or the thing that you want to kind of reach lightly. You don't want to just say, hey, we can't provide a reasonable accommodation because it's going to be expensive for us to allow you to not get the vaccine or something to that effect. That's not what this is. So the things you should consider prior to implementing a mandatory vaccination policy, there are a number of them. Really, the big thing is just what are you trying to avoid as an employer, or what situation are you trying to remedy with requiring a vaccine? Currently, and I know this is the question that pops up frequently, is if all of our workforce is vaccinated, are we suddenly exempt from social distancing requirements? Are we exempt from mask requirements or hand hygiene regulations? Are we exempt from Cal OSHA's ETS or the emergency temporary standards? And the answer right now is no. There is no regulation or guidance that employers automatically kind of exempt themselves from comply with by virtue of having all of their employees vaccinated. So, so that's kind of the first thing to note. Obviously, you want to consider how your employees are going to react to being required to get a vaccination. The mandatory vaccination policies have the effect of kind of thrusting employers into a very heated political debate. So you've got to think about whether you want to do that. Because you have to navigate the religious belief issue and the potential disability related issues, got to navigate those pretty carefully. You want to make sure that you are familiar with the Americans with Disabilities Act and are comfortable engaging in the interactive process. If all of that is kind of new to you, that may be a really strong reason to avoid adopting some sort of a mandatory vaccination policy. And then in terms of whether, if you are going to go the route of mandating a policy, the question would becomes, do you send folks out to get the vaccine? Do you bring someone in to give the vaccine? And then there are a host of issues that would be surrounding that. A lot of employers have wondered, hey, if an employee gets the vaccine and has an adverse reaction, could there be workers' compensation liability? Could there be civil liability? The answer is absolutely yes. That is a reality out there. There's no broad exemption for the vaccine from workers' comp issues that could arise. There are civil exemptions for the manufacturers of the vaccine, but those protections do not extend to employers. So you could certainly find yourself in a lawsuit dealing with your mandatory vaccination policy. So at this point, I tend to think that the risk of mandating vaccines outweighs the benefits of mandating them. But in any event, each employer needs to kind of carefully consider what policy they will adopt. And then again, just I can't stress it enough. If you are going to mandate, watch out for folks who object on religious grounds or disability-related grounds. With that said, I'm sure there'll be some questions. I already see some questions that are popping up in the chat feature. So I will kind of turn it back to the group. And then this next slide has my information. If you've got questions that come up after this presentation, I'm happy to email or talk with you on the phone. So please reach out.
All right, thanks so much, Seth. Yeah, looks like we've gone a little over here, but we've got some great questions popping up here, so we can bring up all of our presenters. Dan and Del, if you'd like to come up. So we'll kick it off. Del, this one's coming to you. Do fully vaccinated employees need to follow the same procedures for quarantining when they're exposed to a positive COVID-19 case?
So in general, and this is, going to vary by state because some of the states have implemented higher standards. And I think California is one of those 24 states. So Dan, you would be better at this. If the person is fully vaccinated, then no, I would go ahead certainly and test, because as I said, anyone vaccinated can be exposed and then become ill again, but they don't need to quarantine. And it is the testing that becomes the issue. Dan, what is your thought?
My thought is in California, you probably should quarantine because the way it's written in the regulation, we have not addressed the vaccine. So it's still considered an exposed worker and will need to quarantine.
I think that answers our next question, which was also asking if a fully vaccinated employee was going to travel, say to go to Mexico, visit family, and then came back, do they still need to have that quarantine time?
I know in California, there are guidelines from the governor's office and the California Department of Public Health that address non-essential work-related travel. And I believe they typically are still requiring quarantine. But that, I think it really falls under the public health aspect, not quite Cal OSHA. Has anyone heard anything else on that?
Well, and that continues to be the case because things are not catching up, particularly for foreign travel to places where the vaccination rates are so low and the epidemiology is so great. So again, I would think that while people are talking about isolation for 14 days, you'll be able to start testing and then you'll be able to see somebody probably at about 5 to 8 days demonstrating some symptoms. And that then becomes the question posed earlier about integrating them in a way that is protective to everybody else, and making sure that everybody is also observing, proper use of PPE and social.
Great. So what's the average amount of days that a person might feel symptoms after receiving their vaccination? We all heard that the first or second shot might have different responses. Someone has an employee who received the second dose almost a week ago and still is saying that they don't feel well enough to come in.
I think if you listen to what Seth said, and that's probably the decision that you need to go with, it's not unusual. Most people go 2 days, perhaps 3, that you have someone who says at a week that they're still not feeling well. From what you were saying, Seth, my assumption is that you need to adhere to their statement of how they're feeling, but that would be the basis for the decision. There's really no set experience.
Yeah, that's a great point. You really have to take the employee's word for it. There's just not, at least for the paid sick leave considerations, there's not a there's not a lot of second guessing we can do with regard to this area.
All right, Dan, a question on everybody's mind right now. Is there any sort of timeline for Cal OSHA to amend the ETS or update the information addressing a vaccinated workforce?
I know Cal OSHA has developed an advisory committee and have had public hearings. But other than that, I have no idea on timeframes. We are we're getting all the questions still, and we would like to know as well. But I'm hoping within that we'll get something eventually. And quite often it might be, some of the changes might be coming through a governor executive order. So it's just a wait and see. Unfortunately, there's not anything yet.
Dan, there's some speculation that there'll be a national a more emergency order. Will that supersede California, or will California stay ahead of whatever comes out federally?
There is talk of a national regulation at the federal level, and at that point we'll have to see if our regulations are as effective. In order for a state to have their own OSHA plan, our regulations have to be as effective as the federal regulations. So if federal OSHA adopts a regulation and parts of it are more stringent, then those more stringent parts will have to be adopted in California.
Okay. Do you have any information on the experimental temporary variants?
Not really.
Easy answer, no. All right, we'll have to get back to you on that one, Karen. Del, you had mentioned N95s. Dan, I think you might have as well. Are the N95s with that exhalation valve, are they considered PPE for COVID-19?
They're not standardly nationally. I don't know if California has a different perspective, but no, the valves then make them incompatible with required PPE.
I would agree with that. If the latest from CDC is double masking, but though NIOSH does not recommend putting any type of mask over any type of respiratory protection. So the N95 I know have been prohibited by like the city, county of San Francisco, even for public use as a source control. And in the workplace, we would also probably say they would not be acceptable as a source control.
Okay. Turning over a little bit more to Seth, but of course, feel free to jump in if you two have any comments or helpful info. And there's a really loud car out front, I'm sorry. Do we need to pay employees going out of state or out of the country if they're going to care for a family member due to COVID?
Yes, if it's a covered family member, you would need to pay them. It doesn't matter where that family member is located. Yeah, great question.
If an employee has missed time due to their vaccine-related symptoms, but then they can make that time up within the same pay period. Say they missed Monday, but they can make up that time on Friday. Would that COVID leave time still need to be applied?
Currently, yes. Yeah, under the current, just the basic text of the regulation, yes, the answer is yeah, they would need to be given that COVID paid sick time. We wouldn't be able to look at other time that they might be able to work. If they are missing for a qualified reason and they request it, then we have to pay it.
Okay. If an employee didn't get the vaccine through the employer, so we can't confirm whether or not they actually were vaccinated, can the employer then request to see their card, their passport, if you will?
Yes, that's a great question and a very thorny issue. The answer, at least right now, from the EEOC and the DFEH, which are the kind of governmental agencies that would regulate that sort of a thing, they say that you can request that information. That is not a medical examination or a disability-related inquiry, but you would really want to be careful with follow-up questions. So just asking for the card or proof of vaccination is not problematic, but the follow-up questions that it may prompt could be problematic. So you'd really want to be careful to make sure that you're not asking questions that would constitute a medical examination or a disability-related inquiry.
Okay. Some more questions about documentation. For the California supplemental paid sick leave, they can't require documentation to approve leave, but then for the federal tax credit, they do need to have proof of it. So I agree here, sounds like a catch-22. Do you have any advice?
Yeah, so, and that really is a pretty specific tax advisor question. So I'm not up to speed on all of the necessary documentation or what documentation would satisfy the IRS. And so I don't know the answer to that question. but talk to your tax advisor, certainly.
Excellent. Retroactive leave. So something that it looks like they have retroactive leave that was paid less than it should have been paid. So it might be paid part, but not the full amount. And the employee is no longer working with us. Should we mail them a check for that full amount, or should we wait for them to request that amount?
That's a great question. So the should we questions often get into to legal counsel. So I'm gonna Elena, I'm gonna avoid answering that in a legal counsel way. I'm happy to connect with you after this presentation, but from a purely just what are you legally required to do? The law says that if you've paid it out previously, a retroactive payment, and it wasn't enough, then you need to go back and true up the employee to where it would meet the calculation under SB 95.
All right, just a couple more here. Does the FFCRA require us to look back 180 days, or can we use 90 days and still claim the FFCRA tax credit?
That is another great question for your tax advisor.
We'll have a tax person on next time.
Yeah.
All right, looks like we've got one more here, and we'll let y'all go. Thanks so much for sticking with us as we're going over here. So regarding the paid sick leave, if an employer allowed employees to use any unused balance from the 2020 allotment of 80 hours of COVID paid sick leave, do we need to add that remaining balance to their 2021 allotment of 80 hours? Or should we treat any hours used this year as coming out of the 2021 allotment rather than that 2020 remaining balance? And that's a lot. So it is in that Q&A there if you want to read the text as well.
Yeah, so then it's a great question, a complicated question, but a great question. If you have previously if you made a payment from January 1 until now, and you paid it out in a fashion that was kind of similar to the prior paid sick leaves that were out there, you may be able to go back and use that to cover this new SB 95 leave. What you'd want to do is make sure that the qualifying reason was one that was covered under this new law, and then you'd also want to make sure that you paid out at a rate that was as favorable as this law. So as long as you satisfy both of those reasons, then you could theoretically subtract it from their SB 95 allotment. And then in terms of just kind of generally, just know that the prior supplemental paid sick leave that was out there and the prior federal supplemental paid sick leave, those actually don't carry over. So generally, I know a lot of employers did that, but generally speaking, they don't just carry over. They expired on December 31st of last year.
All right. Well, hopefully this answered more questions than it created, but I'm sure we'll be seeing y'all again as this continues evolving. So thank you so much to all our presenters for all your time sharing your expertise. Thank you to the UC Davis Western Center for Agricultural Health and Safety for helping us bring this information to you as our sponsor. And of course, thank you as always to our interpreter, Lourdes. So with that, we'll let you go this morning. And we'll catch you next time. Thanks so much, everyone.
Thank you very much.
Thank you.